sorry, who is that?
Hey, any of you speakers?
Oh, okay, great, thank you.
That's right. I was looking at that for a second.
Yeah, you should be. When the volume is on.
Our volume will be,
Yeah.
this is just.
Up here.
Yeah, it'll be up to you. It should be okay, but not,
Okay.
the presentation, but.
I would say what you normally would do when you're here doing a board meeting.
Yeah, sometimes.
You can do that.
There's a
We don't have a mult box here.
Yeah. I think we'll be fine on the
You should be fine.
Yeah.
Okay, great, thank you.
This is live.
You already moved on?
What is the order that he's speaking?
After me? I just texted you.
Somewhere from my television. If he's not on, then we'll skip. We'll come back to him.
So I can transition to page. Are you guys ready?
Come back.
We're ready. Are you
I'll
good?
transition to you. Okay.
Do you want this? I'm going to turn the stick off then. I'm going to turn the stick off.
Okay.
Welcome, everyone. For those who are on the phones, please mute your microphones on your telephones, or we will get hold music. And those who are on hold, do not put your phone on hold, actually. Good evening. My name is Greg Hart. I am chair of the Santa Barbara County Board of Supervisors. Public health and safety is Santa Barbara County's highest priority. I want to assure every member of the community that the County of Santa Barbara is... Just one moment. I want to assure everyone in the county that our county government is doing everything we can to prepare for and respond to the coronavirus, also known as COVID-19. This is the time we must all act in the best interest of our community and work together to contain this virus. Today, our public health professionals will be providing critical information. What you will hear has been developed in consultation with local infectious disease experts, as well as through the guidance of the California Department of Public Health and the Centers for Disease Control and Prevention. These actions are designed to protect our community and to keep us all safe from what has now been declared by the World Health Organization as a global pandemic. You may notice that our press conference today looks a bit different than what we usually do. We are ensuring that all the participants in the media are at least 6 feet apart to now begin the practice of social distancing. To specifically discuss the actions Santa Barbara County Public Health is taking today to ensure the community is safe, I would like to introduce Dr. Vondo Reynoso, our county's Public Health Director.
Thank you, Supervisor Hart. And again, my name is Dr. Vondo Reynoso. I'm the Public Health Director. Our number one objective at the Public Health Department is to protect the health of our entire community, especially the most vulnerable. Therefore, we've declared a local health emergency this afternoon in response to COVID-19. In addition, we also issued a health officer order to mandate social distancing in Santa Barbara County, effective immediately and until March 30th. We will amend the health officer order as needed. Even though we have 0 cases in Santa Barbara County, we're taking these 2 actions because of the declaration recently by the World Health Organization that COVID-19 is a pandemic, and also because of the recent California Department of Public Health issuance of recommendations on social distancing. The health officer order provides firm parameters for canceling or postponing group gatherings that are non-essential, professional, social, and community gatherings. Mandating social distancing is timely and a proven strategy in prior pandemics at delaying the rates of transmission and reducing illness and death. We all have a role in protecting each other's health, especially vulnerable members of our community. We need everyone's support and commitment to social distancing. With that, I'd like to turn it over to Dr. Henning Ansor.
Hi, this is Dr. Henning Ansor, Health Officer of Santa Barbara County. Can you understand me okay on the phone?
Yes, we can hear you. Thank you, Dr. Ansel.
Thank you. In order to protect public health and slow the rate of transmission of the novel coronavirus in our area, we are implementing measures that have proven to be very effective during previous epidemics and pandemics at delaying rates of infection and reducing illness and death. For Santa Barbara County, we are ordering that large gatherings that include 250 participants or more to be canceled or postponed. This includes gatherings such as concerts, conferences, and professional, college, or school sporting events. Furthermore, smaller gatherings need to allow for social distancing of 6 feet in between individuals or should be postponed or canceled. Gatherings of this kind include crowded auditoriums in rooms or other venues. In addition, gatherings of individuals who are at the highest risk for severe illness from COVID-19 need to be limited to no more than 10 people. This would include gatherings such as those at retirement facilities, assisted living facilities, developmental homes, and support groups for people with health conditions. These measures will go into effect immediately until the end of March, at which time the Public Health Department will evaluate if they need to continue at that point. Based on where we are in the progression of this epidemic, it is essential that we implement social distancing, as it is the most effective way to slow the spread of disease. We urge everyone to begin with these measures today, not only to protect themselves, but also our most vulnerable neighbors. Thank you. And now I turn it over to Paige Batson, Deputy Director of Community Health.
Hi, my name is Paige Batson. I'm the Deputy Director for the Community Health Division. Excuse me. My name is Paige Batson, and I'm the Deputy Director for the Community Health Division of Santa Barbara County Public Health. Today, I'm pleased to again echo the fact that we have 0 cases of COVID-19 in Santa Barbara County. We are currently monitoring 9 individuals we've been notified through the California Department of Public Health as travelers. To date, we have monitored 61, and all have cleared. We have also tested 6 individuals that we consider persons under investigation. And what this means is that individuals who have met certain criteria for testing. And we're also pleased to say that those are negative. In terms of what is happening in California, as of this morning, there are 198 cases of confirmed COVID-19 with 4 deaths. There has been a lot of questions coming to our department with respect to testing. And testing has been expanded. We now have 17 labs in California that are conducting testing. That includes San Luis Obispo County and Ventura. We also have 2 commercial labs that have recently come on board, and that is Quest and LabCorp. And while testing has been expanded, it's important for everyone to know that there is still certain criteria that needs to be met for persons to be tested, because we have to prioritize those that are at greater risk of having adverse outcomes. And those individuals, or those at-risk individuals, include individuals with chronic medical conditions such as lung disease, heart disease, diabetes. It also includes individuals that are hospitalized and individuals over 60 years old, as well as prioritizing individuals that are in congregate settings such as skilled nursing facilities. And so, again, testing has been broadened, but we're still going to have capacity issues. So the main point here is for everyone to understand that COVID testing is not necessarily going to be offered or provided upon request. So with that, I'll transfer it over to Jan.
Hello, I'm Jan Kobler. I'm the manager for Public Health Emergency Preparedness at our health department. On Friday, we opened our Public Health Department Operations Center in order to coordinate COVID response with healthcare and long-term care providers, and also identify our county's most vulnerable residents. Our healthcare providers are making requests of us because they are experiencing resource shortages, such as shortages of masks, procedure masks, and so forth. And the health department, through the Operations Center, is able to fill those requests at this time. Today, we also made a request to access a cache of resources held by the state of California, the California Department of Public Health, and we're hoping to get more resources through them. We are communicating directly with our skilled nursing facilities and our assisted living providers. These are facilities that serve some of our most vulnerable residents, and many of them have already implemented restrictions on visitors, restrictions on activities for their residents in order to prevent the spread of disease, which we have seen so vividly in Washington State. We're also working with senior service providers and an area agency on aging to coordinate information to keep seniors who live individually at home safe, and also to make sure that the senior meals continue, even though certainly some of the senior activity centers will limit their activities now due to the need to provide social distancing. If you want more information, you can visit the Public Health Department website at publichealthsbc.org. And now I'm going to turn it over to Kelly Hubbard at the Office of Emergency Management.
Good evening. My name is Kelly Hubbard. I am the Director of the Office of Emergency Management here for the County of Santa Barbara. Couple items I wanted to bring up this evening is, one, in addition to the health emergency declaration, the county has issued a local proclamation of emergency. This is done by the Director of Emergency Services, the CEO for the county, and this is to support our operational response to the incident, to help support Public Health Department in their response to the community. This will include the activation of the Joint Information Center at our Emergency Operations Center, and the activation of the the call center. The call center is for community questions. That phone number is 833-688-551. Again, 833-688-551. The call center is open and available this evening until 10 p.m. to answer phone calls from the community if they have questions. We will be open again tomorrow from 8 a.m. to 5 p.m. And based on call volume, we will probably be open over the weekend as well, and we will announce those hours as needed. These opportunities, doing the local proclamation, gives us the ability to coordinate with our community partners and our public health department and utilize the resources available, such as our volunteers, to help me on that call center. So thank you very much, and I'm going to turn it over to the supervisor.
We'll first take questions from folks here in the room, and then we'll go to the media that are on the phone. So who would like to begin? Yes, please.
In terms of testing,
folks on the phone can for sure hear it. The question was in regards to testing. Where have been the preponderance of tests taken? Were they North County, South County? What can you tell us about the geographic distribution of the testing?
Sure. Of the six individuals that we have tested, 5 have been in South County.
Any other questions here in the room? Yes.
Anything on local schools closing at this point, or what would have to happen for that to occur?
The question is there any information about local schools closing and what would have to happen for that to occur?
I can answer that. So we are in lockstep with the school superintendents, and at this point in time, I'm not aware of any decisions to close schools. So our health officer order is not affected for classroom activities, is exempt from that. However, again, we are in close communication with the schools.
So if we were to have a confirmed case, would schools be closed as a result, or how would that work?
If we were to have a confirmed case, would schools be closed as a result?
I think that we would need to take that type, what the case is and the nuance of the case, whether it's travel related, whether it's community transmission. And Dr. Ansor, do you have any additional information or page?
Yes, I do.
Fortunately, this virus does not affect children much. So school closures have never been shown to be very effective in epidemics when we close them, except if one school would have a significant outbreak, we might consider to close down that one school. What we do recommend, however, is that all schools have a very robust epidemic plan in place with frequent cleaning, with smaller size classes, spreading out the children more, having maybe staggered events like school hours and recess, and activities that are not mandatory should be canceled. So sporting events or dances or something should not take place, but daily routine school should continue because it has never been shown to be a very effective measure to stem an epidemic with closing down schools, and it would really be an extra significant burden on the parents and the community.
Are there any other questions? Yes.
Could you talk about the capacity of our health facilities? I know it's still flu season, and we've heard it's actually a particularly bad flu season this year. So can you talk about available bed space, capacity of Cottage Hospital or other facilities?
The question is, can you talk about the capacity of the local health facilities? This has been a troublesome, difficult flu season, and what is the capacity of our health facilities?
I can speak to that.
Thank you, Dr.
Our
Answer.
partners, our hospitals are really well prepared. They have trained their staff accordingly. They have plenty of negative pressure rooms and protective gear for healthcare workers. They have very good epidemic plans in place, and we are in very close cooperation with all of our partners and the hospitals, meaning the outpatient providers as well as hospitals in the county. And we feel very confident in supporting the efforts to help the ones who come down with the disease.
Jan, do you have additional information?
I might just add that we have about 60 airborne infectious isolation rooms in our county. And in addition, we've been working with our hospitals to augment their ventilator equipment. And so we have taken our cache of ventilators, and several of the hospitals have taken extra ones, so they're going to have a good supply, and they're getting those ventilators ready just in case they're needed. So that will really supplement what we already have.
Yes.
From a medical perspective, I think this is for Dr. Ansor, to explain how an average of 35 kids per classroom in a confined area is less dangerous from people being out on a sporting field in open air. So the explanation in terms of that decision making, where one is shut down to March 30th when thousands of others are shoved into a classroom.
Dr. Ansor, the question was in relation to students in a confined space in a classroom, how is that less dangerous than a larger number of people who are outdoors at a sporting event?
Well, at sporting events, not so much the teams that play, but more the spectators. I mean, NBA, has canceled all their games. All big sporting events and small sporting events are notoriously, people are very close to each other. And just getting through the gate and standing in line, and it's a big crowd usually. I understand that Little League and school events are none of that be mentioned. However, it's a non-essential function, and therefore we would encourage them to cancel those. We ask them to cancel those. Now, with regard to classrooms, we are asking the students to be very creative and inventive in making sure that their kids are not too close to each other, as I mentioned before. So we are working closely with the school superintendents, with the school boards, and they have also very good plans that have been vetted by us and discussed with us at the next, and I think they're really well prepared.
Any other questions? Yes.
Has any sort of plan been discussed for social distancing at the jail?
The question is, have there been any plans made for social distancing at the jail?
I can speak a little bit to that. I can tell you that they're very alert about what is going on, and they're enhancing their sanitizing and disinfection procedures. But also, in the event that an individual should begin showing symptoms, they also have negative pressure rooms where they would be able to effectively isolate an inmate if need be. So staff are prepared with N95 masks, and so there's different mechanisms that they have to protect themselves. But in terms of distancing, I'm not sure exactly what they've done in terms of that full distancing. As you can imagine, it would be difficult in a jail.
So can I just want to reiterate that this health officer order is really to restrict unnecessary convenings, unnecessary gathering. So we know that there are essential functions, school-related, jails, court systems, travel, that are necessary, that are necessary and critical, and they must continue.
You had a question, yes.
You mentioned that not everyone who feels that they want to have a test, and not everyone who requests a test will be able to have one, and that right now those tests are going to the most vulnerable people locally who are experiencing symptoms. What is the message to people who might not be part of that group but are still feeling the symptoms and feel like they need to be tested?
The question is that tests are not available currently for anyone who would request a test. What is the message to those folks who will have to wait?
Actually, the message would be for anybody who's having any symptoms of any kind should be reporting to their physician, because there are other respiratory conditions going on right now, including influenza. So especially others that have other chronic medical conditions, they should be consulting with their doctor. All we're saying is that there is some specific criteria that should be met. It isn't one of those tests where an individual can simply go and say, I'd like to be tested, because we are dealing with a lot of worried well. There's a lot of people that are concerned and they just want to know, whereas there are individuals who really need to know whether or not they've been infected. Also, from a public health perspective, it's important for us, for the disease control programs to get out there, and our public health nurses to get out there and begin their investigation and begin doing contact tracing, and if necessary, quarantining others who may have had exposure. So that's a lot of the reason behind it. Additionally, as I mentioned, there's even though we've expanded our testing capacity, It's not going to be enough to support individuals wanting a test just because they want it. So it's growing and it's subject to change, but also the demand is we anticipate that it's going to increase.
Other questions in the room? Yes.
Just want to follow back up on a statement made. So athletics were determined to be unnecessary at the high school level?
The question is following up on a previous point about whether athletics are prohibited on school campuses.
So we're
No, they should not be prohibited because they are part of the regular curriculum. We mean to ask schools to cancel extracurricular activities.
Okay, I'll follow up with that. That's sixth period for most of those athletes, which is about thousands of athletes. So that is actually a class for these folks. So it actually is part of the curriculum.
So the refinement of the question, Dr. Answer, was that these athletes are participating in a class in sixth period on their campuses, and is that activity restricted?
Sorry, I couldn't understand the question.
I'll try it again. The question is about student athletes on high school campuses. Their sixth period class is often athletics, the various sports that they are participating in. And so would that be restricted in any way?
No, it would not.
So could they technically play games during that time?
And then the rest of the additional follow-up was, so they can technically play games during that sixth period time. Is that also allowed?
That would be allowed, just they couldn't have any spectators.
Any other questions in the room? Well, yes.
One last one. We got word shortly before we started here that there have been a few clusters of residents in retirement communities experiencing flu-like symptoms. And I was curious if that's something that's true, if that's accurate, if you guys are monitoring anything along those lines, and B, if there's any testing being planned for those individuals.
The question is that there have been reports that there have been clusters of residents in nursing homes that are exhibiting flu-like symptoms. And number one, is that true? And number two, the B part of that question was,
if any testing is being...
Has any testing been done on those individuals?
So, first of all, any clusters or outbreaks of any kind are reportable to the Public Health Department. And today we are not aware of any clusters, of any respiratory clusters or anything else. Should we have received such a report, we do work very closely with our skilled nursing facilities and our various groups to assure that necessary testing is done.
We'll now move to questions from folks who are on the telephone. Please start, and we'll try and organize you as you identify yourself. Are there any questions from any of the media that are on the telephone?
There's a question about restaurant businesses in the Santa Barbara area.
And is that being broadcast? Or do I not need to repeat that question? Okay. Well, if it's clear audibly, I think we're okay. So, who would like to answer that?
So I believe the question is, how does social distancing affect restaurants in our county? And I was just speaking with our environmental health services staff earlier to ask them, what are the implications for this? And they are working on some procedures and guidance for restaurants so that they can continue to operate given the instructions for groups and for staying 6 feet distance from each other. So they're going to be working on that tomorrow, and we hope to have that out by the end of the day because it is Friday for the weekend.
Are there other questions from folks on the telephone?
Yes. I would like to know if the county is possibly looking at installing some, like the Marburg event hand washing stations around different areas to maybe get people who are out and about, to wash their hands more frequently.
Yes, Kelly?
The answer that's going to be...
Dr. Answer-Terry is here, and she has more information.
So currently we were planning to deploy 12 hand washing stations at various locations throughout the county, and we're working on siting those as we speak, and we'll have more information on that out tomorrow.
Are there additional questions on the telephone?
Yes, I have a question about whether or not the county is going to close like planning commission and council meetings to just live stream those.
The question was whether the county is planning to close planning commission meetings, city council meetings, I presume the board of supervisors meeting. And at this time, we are not planning to do that. We are going to try to practice social distancing through our meeting process. And here in the hearing room, we have identified seats to give the proper distance for folks to use the facilities and continue to access their government.
And I think the information center phone number had one number missing.
The phone number for the
Yes,
Holland
I
Center
bring that up.
is 833-688-5551. That's 833-688-5551.
Thank you.
Are there additional questions on the telephone?
Yeah, I was wondering if you could tell us a little bit more about the people who were tested, the demographics. Were they young? Were they old? Were they people that traveled out of the country, et cetera?
I'm sorry, but I do not have that data with me today.
Okay.
Any other questions on the telephone?
Could you confirm the number of people who are still being monitored?
Yes, that number is 9 as of today.
Thank you.
There's a question in the room.
Can you expand on that, what monitoring means?
And the question from the room was, can you expand on that? What does monitoring mean?
Okay, monitoring means is that the individual is self-isolating in the home with public health supervision for 14 days. And what that means is that with public health supervision, we are checking in with the individual to monitor for symptoms, i.e. fever, shortness of breath, cough, and any other symptoms. And so after 14 days, then they are released from self-isolation.
Any other questions from the telephone? All right, well, I think if there are no other questions, I want to thank everyone for coming. Thank those that are here today presenting this information. We appreciate you being here to help share the information with the community. As a reminder, the call center phone number is 833-688-5551. It is being staffed now, so if members of the public have questions, please feel free to call. There is additional information at the county's coronavirus website, which can be found at publichealthsbc.org. That website again is publichealthsbc.org. Thank you again for attending, and have a good evening.
Okay, so just wrapping up, that was the first live press conference from Santa Barbara County Public Health, and so many in the community really wanting some answers to this. We did learn that this social distancing is a mandate to remain 6 feet from people when we're out and about. Also really dwindling the crowd numbers, 250 to be postponed or canceled, 16 also postponed, and Dr. Henning Ansborg said something about 10, groups of 10. It was difficult to hear him because he was coming live over the telephone. So,
but there is you can go to the website, the county website, for any questions. There is a hotline set up, and we have that number here. It is
833-688-5551.
5551, and that's a call center set up for general questions or concerns that you may have. Because as we just heard, there are a lot of questions that remain to be answered.
That's right. We do know this is a confirmation, 0 confirmed cases of coronavirus in Santa Barbara County. However, they are monitoring 9 individuals. These were all travelers. At one point, they were monitoring a total of 61 people. Again, testing negative. These 9 people, though, again, we didn't know the length of how long they've been monitored, but that's happening right now, currently.
All right, Ryan Fish is live there right now. Let's head over to him with some more answers.
Well, hey there, Beth and Janelle. And as you mentioned, 9 people was the number given at this press conference that were tested, or should I say 6 people that were tested, all negative for the coronavirus, but 9 people currently being monitored. And they explain what monitoring means. Specifically, that is people who are self-isolated in their home, being supervised by county public health officials for 14 days, and they are monitoring for those symptoms of the coronavirus, including fever, shortness of breath, or cough. So that's 9 people in the county, but this is something that we're going to continue to take a look at, and those numbers could very well change very quickly in terms of the number of people monitored or number of people tested. And so that's something that we're going to keep an eye on here as we go forward. Even with these new mandates, those numbers certainly could change at a moment's notice. And something else that was brought up in the press conference here was the questions about school closures, potential school closures, if that's deemed necessary. Right now, the message out of this press conference from county officials was that this is a press conference banning non-essential gatherings of 250 people or more, non-essential events, things like those sporting events at a professional college or high school level. However, and noticing that school was deemed necessary at this time, but we are seeing changes when it comes to education. We're seeing schools, colleges go to online-only classes across the country. And so far, that measure or school closures have not been instituted here in Santa Barbara County. The word from these health experts saying that sometimes that doesn't do a lot of good because of the way that these viruses work. But, of course, all of these situations are different. This is an unprecedented situation we're dealing with now. But for the moment, they are not mandating any schools to close or go online for public schools in Santa Barbara County at this point. So that was something that came up in the press conference here that I'm sure a lot of viewers out there are going to be wondering what is going to happen with local schools.
Thank you for that, Ryan. And I do want to add that Dr. Ansorg said that students are being told to keep a distance from each other.
Right.
So parents are going to like that or they're not. That's kind of how he was leaving it.
A big point was that social distancing, and that is the precaution that we do need to take. At this point, there are 0 confirmed cases, but we are taking these precautions. And another thing that they were mentioning is the testing. The testing is being expanded, 17 labs in the county, but there is still criteria that needs to be met if a person is going to be tested.
That's absolutely right. Individuals with chronic lung or heart disease, individuals in hospitals, individuals over the age of 60. COVID testing will not be offered upon request. They made that clear. 2 takeaways also happening tomorrow. They're looking at new guidelines for local restaurants and businesses, hoping to have that information released to the public tomorrow. Again, that 6-foot distance between customers and people who are participating at certain businesses and restaurants. Also, looking to install 12 hand-washing stations out and about throughout parts of Santa Barbara County, trying to decide where to best place those.
And they'll release that information tomorrow.
Right. So you can go ahead and monitor our mobile app, also our website at KEYT.com for more information on this update from Santa Barbara County Public Health.